Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
WOR, New York.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back and talking more about other patients and news and items that may be of interest to you. One of my patients just heard the overnight show talking about the benefits of low-dose aspirin, the 81 milligram aspirin. He's one of my patients. He listens to the shows, and he heard about the reduction in cancer, rectal cancer, in people who take 81 milligrams of aspirin. And there's a lot of other potential benefits, and we'll talk about that, but it may be something that's of interest to you, and it may help improve your life and lengthen your life. Another patient in the good news department came to us. He's about a 50-year-old man with neuroendocrine cancer. He has a neuroendocrine cancer that spread extensively to his liver. He had extensive systemic treatment elsewhere, didn't work, came to us, had the treatment. 5 treatments, 15 minutes each, non-invasive, came in, got his treatments, went to work, doing great. He's getting the follow-up on Tuesday, and we'll report back to you next week. And we have another patient who came to us, a man who's 61-year-old black man, and I say it because he was diagnosed several years ago and never got treatment. So he's got a Gleason 7. Several years ago, his PSA was 8, which would have made him an intermediate risk. There's 3 risk groups for prostate cancer. Low, if your PSA is less, PSA is the blood test. If your PSA is less than 10 and your Gleason is 6 or less, that's a low risk. Intermediate risk is if one of those 2 are out of range, and high risk is if they're both out of range. Well, he's now gone from intermediate to high risk, and he still has a good chance of being successfully treated with us. Most likely he will be cancer-free, and the data's in our booklet. If you open up the booklet, you will see that data, us versus a major cancer treatment center, and I'm just looking for the page now, if I can find it. Here it is, page 8. So if he went to a big cancer hospital and had conformal radiation, which is the 8.5 weeks of radiation, his success rate would be only 35%. Had he come for treatment 3 years ago with conformal radiation, his success rate would have been 65% there. But, thank God, our success rate for high risk today for him is better than their success rate for intermediate risk 3 years ago. So our success rate for high risk, comparing us to a big cancer treatment center, big cancer hospital, our rates of success for prostate cancer in the highest risk group are 91% better. You can see the data. It's page 8. This is all published data, their published data versus our published data. So how is it? Well, it's technique, it's experience. We've been at this 20 years. We've done thousands of patients with brachytherapy. We put We treat the men in the stereotactic frame. We aim to hit the prostate. And remember, the prostate sits right between the bladder and the rectum, so aiming is critical. We don't want to hurt the bladder, we don't want to hurt the rectum, but we want to kill the prostate cancer. And then we give 5 weeks of daily treatments Monday through Friday in the high-risk groups, and then prostate brachytherapy, where we put the seeds directly through the skin. It does not go through the penis, the scrotum, the anus, the rectum. No. It goes directly through the skin into the prostate. We have a whole team that works together. There's an anesthesiologist. So the man feels nothing, goes to sleep, puts in the seeds. It takes about 45 minutes. We have our own operating room, so the patient can come in, get the procedure done, wakes up, urinates, and goes home, goes to work. And that's what this man has seen the data. That's what he wants to have happen, and it should give him the best chance to be cancer-free. Look at the data, and we believe in the data, and you may want to look at the data before you make a decision, because if you have the wrong decision, you're talking about 20-30% success rate. With surgery, it's not only high rates of failure, but also lousy quality of life, and we're talking about sexual life and urinary life. And I just want to talk about one more patient with stage 4 cancer, and often people are told, I have stage 4 cancer, you need chemotherapy, chemo. Well, this is a woman from Colombia, South America, and she's actually been coming to me for about 5 years. She has metastatic gynecologic cancer, mixed Müllerian tumor, started in the gynecologic area in her reproductive organs, and she had chemo, it didn't work. So now, when she has a nodule of growing cancer, she gets it hit with radiosurgery. When she doesn't, she's on holiday. She goes every year to Colombia for 6 months. So she has a good quality of life. We've treated a variety of sites where cancer was growing. She's in remission now. She's going to go back to Colombia and come back in 6 months. She's doing well. She's not tied to the chemo pole. So, yeah, of course, you can take chemo if you want. That's one option. She's been going at this for nearly 5 years now, without chemo, doing well, excellent performance, fully functional. If you saw her walking down the street, you say, wow, what an elegant, healthy, nice woman. And she is an elegant woman. And right now she's healthy in remission, so she's doing great on radiosurgery when she needs it. And another good news department, we had a man come in who had a PSA a year ago of 7.36 prostate cancer. He had our premier program, which is treatment in the stereotactic body frame and brachytherapy, and his PSA is already down to 0. So he's doing great. He's got good quality of life. His sex life works. His urinary life works. His PSA is down to the 0 range after our program, maintaining his body functions normally. And that's what we want. That's what he wants. I hope that's what everyone wants. And another man, interesting, came to us from Bangladesh. This man woke up in January and he couldn't breathe. In Bangladesh, he was worked up for heart disease. They found it was okay. He then transferred his care to America. He went to a cancer hospital, and he was given extensive chemotherapy. He was given one chemo for about 3 months, and he was given another chemo for 3 months, and that was it. They put him on hospice. Hospice is, just care until you die, but not medical care per se. So he came in this week with his son, his wife from Bangladesh, and we staged him up. Staging means we find out exactly where the cancer is. Now you may think, wow, they put him on hospice. That means the cancer must be all over his body and helpless. No. We staged him up. Almost all the cancer was confined to one side of the chest. There were a couple abdominal lymph nodes, which could easily be treated with radiosurgery, but the cancer was confined to one side of the chest. So we've treated mesothelioma. We actually treated quite a few patients with mesothelioma, which is a kind of lung cancer that's precipitated by exposure, it's believed, to asbestos. Asbestos used to be widely spread around America, around pipes and car parts and brakes, and a lot of people didn't know the risk and had a lot of exposure. Well, this man is wishing to proceed with treatment. He got off hospice immediately. He wishes to have radiosurgery, and will do radiosurgery to his mesothelioma in his left side of the chest, which is causing pain. It's probably pressing on the nerves there. He's got several lymph nodes in the abdomen, but several, few and small. So we'll report back to him. There was a study done in Great Britain of all the patients successfully treated with mesothelioma, and guess whose patients were at the top of the bunch? That's right, Dr. Lederman's radiosurgery patients. And if you get our body booklet, there's several different booklets that we send out. So one's about brain tumors, one's about cancers of the body, and one's just about prostate. So if you get the body booklet sent to you, you will see this patient's CT scans before and after treatment for mesothelioma. And there's actually a lot of other pictures in the book. We have several books. One we mail out with all the pictures gone, and one we hand out with all the pictures in it. So if you get the book mailed to you, I think that the mesothelioma picture is in that booklet. If you want the complete index, come in, or when you make an appointment, we'll give you the complete book, and we always mail out the DVD. So it's very important to do that and get some ideas of the work that we've done over many years. These are examples of patients that we've treated. It's not from a drug company or a pharmacy or a XYZ manufacturer. These are our patients, could be like you, our patients that we've treated and the results we've had. It might be very interesting for you to see this kind of work. Surprising, maybe shocking, maybe even beneficial for you. That's what we hope. I want to talk about a man who came in this week also. He's a car dealer. He's 90 years old. He's a little bit difficult. He has 4 children. He's a businessman. He came to me with a PSA of 237 and a catheter in place. Now, he's been on homeopathic medicines for many decades. So issue number 1, he's known about his PSA elevated for 20 years, and he's been taking homeopathic medicines, none of which worked. So you might want to avoid wasting your time if you have prostate cancer taking homeopathic medicines, because you'll see the data, and I'm happy to go over the data showing it just doesn't work. His PSA went from 10. We repeated the PSA when he came in this week. It's now over 300. Luckily, he agreed to get an MRI, and we got an MRI of his prostate, which shows prostate cancer confined to the prostate and seminal vesicles. It does not spread to the bone. It does not spread to the lymph nodes, even though the PSA is 300. He had a bone scan and CAT scan elsewhere. He was in complete kidney failure because the prostate was so big it was blocking off the ureters and the urine. Now remember, the kidneys make the urine goes down the ureters, goes to the bladder, and then it has to go through the prostate to go out the penis into wherever you're going to send it. Now, this man's prostate was so big, it was strangling the urethra. He couldn't empty his bladder. The bladder was huge. The bladder was backing up, and the urine was literally killing the kidneys. So he did have a catheter, and we retested him. Luckily, the catheter allowed the urine to be bypassed from this big prostate. Luckily for him, the cancer does not appear to be spreading, even though it is extensive in the prostate and seminal vesicles. This man has a chance. He's 90 years old. He has everything to live for. He has a loving family. Came in with a son. So it's up to him to make the decision. We staged him up. His kidney function has been saved. Hopefully he'll be able to save his life before prostate cancer harms him. And remember, this man had a warning sign. Unfortunately, took homeopathic medicines for which there's no data. Don't do things that there's no data on unless that's what you want. If you want to do something that's a Russian roulette, do it, but it's not really treatment. It's doing something, thinking you're doing something to help yourself, but basically has no chance. And there's a lot of data actually that shows that men who take certain medicines